This tiny test could be the difference between a healthy childhood and a lifetime of struggle. Newborn babies look perfect on the outside. But what if something deep inside their body isn't working right and no one knows until it's too late? That's why metabolic screening matters. In this video, we're breaking down what it is, how it works, and why skipping it could be a silent mistake. There's more going on behind that little heel prick than you think. That drop gets taken from a quick heel prick, nothing fancy. The nurse blots the blood onto a paper card and sends it to a lab. What happens next is kind of amazing. Here's why this matters. Metabolic disorders mess with how the body processes food. Some of the most important disorders the test catches include phenylketonuria PUQ without treatment. It causes brain damage. With early care, the baby can live totally normal. MCAD deficiency. The body can't use stored fat for energy. Without knowing, even a common cold can turn deadly. Congenital hypothyroidism, missing thyroid hormone that affects brain growth. Easily treated with daily meds, but only if you catch it early. Every state or country tests for different conditions. In the US, for example, most states check for at least 30-50 disorders. Some go above that. The test itself isn't painful for the baby. It's over in seconds, and the benefits? Massive. One study found that early detection from metabolic screening has saved millions of lives worldwide and reduced disability in countless others. But here's the scary part. Not all babies get screened. In some regions, the test isn't required. In others, parents don't even know to ask. And sometimes, labs miss a condition because it's not included in the standard panel. It's like having a smoke detector that only works for half the house. So what can parents do? First, speak up. Ask your doctor what conditions are included in your baby's screening. Don't assume it's automatic or complete. If you're in a place where testing is limited, you can often request expanded screening, yes, even privately. It might cost a bit more, but when the price of missing a disorder is your child's health, it's worth every penny. Second, follow up. Sometimes results take a few days. If the lab finds something unusual, they'll call. Don't ignore those calls. Some parents think everything seems fine and never go in for a second test. Big mistake. Timing is everything here. That little piece of paper with a few drops of blood, it's not just a lab test. It's a safety net. It's a silent guard for babies who look perfect, but might be fighting an invisible battle. Metabolic screening doesn't just give answers, it gives babies a future. So if you're expecting a baby, know this, that tiny heel prick could be one of the most powerful steps in their whole life. One test, one chance, one drop of blood. Check description to learn which newborn symptoms you should never ignore.